Nightmares are a normal occurrence in children. Between the ages of 5 and 8, they tend to become worse. 50% of children this age will deal with a nightmare at least once a week, sometimes more. They can disrupt the sleep of not only the child, but siblings and parents as well. This can lead to frustration and resentment when not handled correctly. We will be talking to Ava about her nightmares. Ava is 6 years old and represents a normal child in this age group.
So, what do your nightmares normally entail?
My mom dying.
Just your mom?
Well, stuff dying.
Okay, stuff dying. Things that you care about, or just anything?
Anything, even stuff I care about.
During the time period of 5 to 8 years old, children begin to understand real-life dangers like fires, car crashes, and death. Due to this understanding, they also start realizing that these things can happen to the people they love. And how do you deal with it after you have a nightmare?
I go to mom and dad's room.
Do they make you feel better?
Yes.
Are you still worried that maybe one of them is dead?
Yes.
Yeah, and then you see them and it makes you feel better.
Yeah.
Many children need to feel reassured that whatever they had a nightmare about is not going to happen. They realize it was just a dream, so try to keep the comforting to explaining how these bad things are minimized in daily life and how it is not something that they need to worry about. There are many things that are believed to cause nightmares in children this age. Violence on television, scary stories, and stress, to name a few. One method to reduce nightmares is to supervise what your child watches and reads and ensure that they are not being exposed to something that might scare them. Another way to help reduce nightmares is to reduce stress that the child feels. While it is impossible to keep them unstressed all day, you can do things like have a bedtime routine that you stick to, do not argue in front of them, and do not put unneeded stress on them in the form of comparisons. If you feel your child is extremely afraid to go to sleep after trying these methods, it is time to talk to their doctor about the issue. Sometimes there are underlying problems that we as parents have a hard time getting from the child, and a specialist who is trained in helping young children can have a bigger effect than us. Finally, if you are struggling with nightmares in your young child, there are several resources out there. An easy place to start is with books to read to your child, such as There Are Monsters in My Room by Michael and Rachel Yu, or Bye Bye Bad Dreams by Stephanie L. Robinson. There are websites such as the American Academy of Sleep Medicine at www.aasmnet.org and www.sleepeducation.org, or books for you, like A Clinical Guide to Pediatric Sleep, Diagnosis and Management of Sleep Problems by Jody Mindel and Judith Owens.